My name is Naman Oyuki. I'm a medical psychologist and I'll take you through a presentation on motivational interviewing. So, do people naturally change when they know how important it is to do so? This is a question that most people struggle to answer. And in motivational interviewing, we attempt to answer that question. This presentation basically is to equip staff at Oasis with the motivational interviewing skills so that they can foster change in patients, probably patients going through addiction cases. So, we are going to look at what is motivational interviewing, what is change and the stages of change, the underlying concepts in motivational interviewing, its adaptations and limitations. So, motivational interviewing is an approach that enhances intrinsic motivation in clients to change by exploring and resolving ambivalence. So, it's simply an effective way of talking to people or patients or clients about change. It's effective because it's evidence based, it's been proven to work in so many people, and there are numerous publications that have proven the efficacy of motivational interviewing. And it was developed by two clinical psychologists, William R. Miller and Stephen Rolnick. Why is it necessary for us as clinicians to be equipped with motivational interviewing skills? I think it's useful in addiction treatment, even in dental health care, in physical activity exercises, in dieting and weight loss, in adherence counseling and medication adherence, in smoking cessation. Throughout our lives, we get faced with difficult decisions to choose, and sometimes we struggle to choose which way we'll go. Things like homework, things like marriage, things like addiction, accepting help often make people to be at conflict with themselves because they wouldn't do or what to choose. And normally in that state, or when change or when a negative behavior is hard to change, it's usually not about lack of information or laziness or being defiant or having a conduct disorder or even being denial. Is simply about ambivalence that we talked about that MIs tries to explore and resolve. Ambivalence is the state of wanting two different things at the same time, or two opposite things at the same time, or the state of wanting and not wanting to do something at the same time, and or wanting two incompatible things at the same time. So ambivalence normally leads to conflict and anxiety because it's uncomfortable, and it's a natural condition of being unsure about change. Everyone of us has experienced ambivalence. Many hard decisions in life, we have to go through ambivalence first before we make a stand or before we go through with the decision that we've made. So most often, when our patients are stuck or are in a state of ambivalence, we often confuse them to be resistant or oppositional or lack insight. And this is normally seen by counselors, psychiatrists, and nurses. They deem patient as resistant. These patients normally procrastinate a lot because they're conflicted, but in real sense, they're not even really resistant. They're just, for lack of a better word, confused. So, am I helped by exploring and resolving the ambivalence and enhancing that intrinsic motivation about the desire to change? And change is something that is very often talked about in motivational interviewing. So we'll need to know what is change and what are the stages of change. It's a concept that tries to explain how the stages people go through with negative behavior or addictive behaviors or addiction. And change basically is a state where is a transition between or a transition from one state to another, that is change. So let's look at the stages of the first stage is pre-contemplation. Most people in their lives have gone through this stage where you don't consider the behavior that needs to be changed as a problem because most probably you haven't suffered a negative consequence. They say someone who smokes a lot and they don't see smoking as a problem, that person is in the pre-contemplation state, like prior to thinking about it, prior to contemplating about stopping smoking, or prior to contemplating about stopping drinking, prior to contemplating about maybe addictive behaviors. And most people in this state are they can be deemed very resistant because they get very unreceptive of other people's opinion, or they are very unreceptive of criticism. And then from pre-contemplation stage you go to contemplation stage, basically where you think or you start to think deeply about the behavior or the problem that needs to be addressed and the behavior that needs to be changed. In this stage, people have started to see how a problem, maybe the negative behavior has become, or maybe how a problem, maybe that drinking, or maybe their anger issues, or maybe their toxic relationship, or maybe their dental health has deteriorated and they need to go to a dentist. So basically, starting to think deeply about making a change in your life. Contemplation to contemplation, you go to preparation. In preparation, you've thought about the problem, you've thought about the negative behavior, you've come to a space where you see the need to stop or change that behavior. So you are basically putting things and resources in place for you to make a step towards changing. So the kind of things that happen in preparation stage is, you know, obtaining the necessary resources, getting rid of triggers, putting support in place. This can be an example is in smoking situation. Once someone has moved from not thinking smoking is a problem to thinking smoking is a problem, they need to set a date where they'll stop. That setting a date where they stop is basically preparation and moving the ashtray away, making sure they don't have the resources to buy cigarettes. All that is in the preparation stage. And action comes when maybe the date set to stop cigarettes or the date set to really move toward, like, make the steps toward stopping that negative behavior or that addiction. That's the action stage, actually making the real change It can sometimes be stressful and uncomfortable as well. So, from action maintenance, which is basically maintaining that new behavior or the desired behavior, and in some places, it could be if you maintain it for 6 months or more, then you're in the maintenance stage. And the last stage is normally called relapse. And because of these stages of change, uh, is a concept that is heavily borrowed from addiction treatment. And having in mind how sometimes relapse is common in addiction treatment, relapse is usually put as the last stage. The idea is not to encourage people to relapse, but to just make them just be real that relapse is a common thing when you don't plan appropriately or when you don't handle lapses uh, uh, in the right way. Don't let us